Hey peeps, welcome back to my YouTube channel. It is your girl Chelsea and I'm back with another video, another sit down video to educate you guys. So I just want to put this disclaimer here. I am a registered nurse and I am in no way telling you that these things are going to cure anything that you may have, but I will say to do your research on them and definitely do plenty of research on it and find out what it may help for you and your situation or whatever you're affected by. So basically I want to talk about glutathione. So glutathione is huge for your skin. Glutathione is an antioxidant that really helps to diminish fine lines and wrinkles over time as we age. So as we age, our body is actually depleted of glutathione. So having it in our system is definitely going to help a lot with protecting your skin, helping with fine lines and wrinkles, and actually it can help with eczema. So if you have anybody that you know that is affected by eczema, which is basically just a skin condition that causes rashes and things of that nature, breakouts. I know my side of the family, my mom's side of the family is largely affected by eczema. So eczema is very common, especially in the African American culture. A lot of us do have this skin condition, which it is totally normal to have it. Glutathione can really help with eczema. It helps with dark spots. It helps with protecting your skin from sun damage. So if you don't know about glutathione, you guys need to get on it because it's going to improve so many different things in your body and improve your skin overall. So I already mentioned the aging process. As we age, our cells are broken down and we lose glutathione over time. So adding glutathione to your body is going to help with fine lines and wrinkles, help with the aging process, of course, slow it down a little bit, and overall just improve your health. So glutathione can be used for cancer progression, so it may help to decrease the progression of cancer. So definitely do your own research regarding that. I'm in no way saying that it's going to cure anything, but studies have shown and research has shown that glutathione is beneficial to people with cancer to help slow down the progression of it. But definitely do your own research on it. So glutathione can also help with gastrointestinal issues. So things like IBD, which is irritable bowel disease, and also ulcerative colitis. So ulcerative colitis can be damaging to your bowels. It can cause cysts and things like that inside of your intestinal tract if you do have those diseases. Or irritable bowel syndrome is also just an irritant of your bowels basically. Glutathione drips or either glutathione pushes at a certain amount have been shown to help with ulcerative colitis damage and irritable bowel syndrome. Lastly, glutathione has been shown to help with Parkinson's progression. So Parkinson's disease affects a lot of people. So definitely do your research on glutathione and how it helps with Parkinson's progression as well. So what is the best way to take glutathione? The best way to take glutathione is intravenously. Really honestly, with a lot of different vitamins, the best way to absorb it is intravenously. So there is such thing as glutathione oral supplement, but I mean it's really not absorbed very well because it's not going directly into your vein. It's not as potent. It's not as high of a dosage. So honestly, with glutathione, it's best to go to a medical spa or your doctor's office if they have this in stock in their area to get it as an intravenous push. So what is the best food source for glutathione? So avocados, okra, which I've never had okra before, but okra, spinach, and asparagus. All four of those are really great for glutathione, but again, when you're taking anything orally, sometimes the way it is digested and things like that, you may not get as much nutrients as if you were to do it intravenously. So you can eat it, but you might not get the best benefit of it. So at pretty much any medical spa, for the most part, they do offer glutathione. But definitely when you do go to a medical spa, make sure that you're finding out the dosage of glutathione that they're giving you. Also find out if they push it into their bag with other vitamins or if they push it separately. So you want to make sure that with glutathione, you are getting it pushed separately. And the reason why is because when you put it in the bag with the rest of the vitamins, like vitamin B12, vitamin C, things like that, it's actually not absorbed very well in the bag. So once you put it in the bag with other vitamins and other agents, it actually diminishes the value of it. So by the time that it does infuse into your veins, a lot of times the potency has now gone down. So definitely make sure that you guys are keeping an eye on that if you do go to any medical spa. And another tip I want to put in here is that when you do go to a medical spa, make sure that their vitamins are not prepackaged. And when I say that, I mean like make sure they're not just drawing up out of one single vial and just pushing everything into the bag. Because again, the shelf life, the potency of it is not as effective as if you were to mix it separately. I'm just giving you that tip because obviously I work in a medical spa, I'm an aesthetic nurse, and we do things differently in my job. So I just want to slide that little tip in there. Alright, so another antioxidant that I want to talk about for sure is vitamin C. So vitamin C is another antioxidant that helps with oxidative damage of your skin. So when I say oxidative damage, any kind of damage that comes along with UV exposure. So if you are going to a tanning bed, if you are a person that flies a lot, does a lot of travel, or if you're a person that gets their nails done like I do, that UV light that they use, even though it may not be as like high of a exposure, I guess, with the nails one, but still it does break down your cells. Over time you can tell that your like fingers are probably a little bit more like older looking, I guess, or like broken. Your skin is more wrinkly. Like your skin is not like the rest of your skin on the rest of your body. So vitamin C can really help with the oxidative damage. It helps with UV exposure from sunlight, things of that nature that break down your skin cells over time, causing wrinkles. So the great food sources for vitamin C would be oranges, strawberries, your citrus fruits, your red and green peppers, your broccoli, and your tomatoes. So again, like I mentioned before, oral types of intake, you want to make sure that you are also in addition doing IV, because IV is going to be more potent versus oral intake it takes a lot longer to process, and a lot of times you don't absorb the benefits of it. So this damn fly keeps flying around. So clients have reported from my experience and also from my research is that vitamin C and glutathione together can really help my girls with our menstrual periods. So if you have really heavy bleeding, or if you have really bad acne, really bad breakouts around your, that time of the month, Aunt Flo, whatever you call her, definitely look into vitamin C and glutathione. And I mean this by doing research on it. There's plenty of research out there about how it can help with heavy periods, cramping, things like that. I don't really know much about the whole PCOS and if it can help that, but definitely do your research on that, because I know a lot of people are affected by PCOS, and you might find some research out there that shows that it helps that syndrome. So, another vitamin that I want to talk about is folic acid. So anytime I mention folic acid to any of my clients that are men, a lot of times they don't want folic acid. And the reason why is because they think folic acid is only for pregnant women or women who are trying to become pregnant. And that's not the case. So folic acid is really going to help with red blood cell production. And when I say that, I mean that in turn, it can help with iron deficiency anemia. A lot of people are affected by anemia and they don't even know it. It is a bleeding disorder, of course, and it can really impact a lot of different things. So if you are anemic, definitely look into folic acid as well, making that a part of your regimen. You can take it orally, but again, you're only absorbing about 30% of it, if that. Folic acid, actually at the medical spa that I work at, we actually can do it as an IV push. Definitely look into folic acid if you are a girl or a guy with anemia. Look into it because it can really help improve your results, your lab results especially. So yeah, don't sleep on folic acid. To my men too, don't sleep on folic acid, because it's not only for pregnancy. So this is pretty much a pretty short video, to be honest. If you guys have any questions about this video at all, or if you guys have any questions about aesthetic nursing, or if you just want to share your story about how these 3 vitamins have helped you in your life, definitely leave a comment down below. I would love to hear your story. You just never know how much your story can help impact others who may be going through a similar experience. So definitely leave a comment down below. Make sure you guys like this video. And make sure you guys subscribe to my YouTube channel. I will see you guys in my next sit down educational video. Bye guys, have a great day.